Okay, so every once in a while we get discussions in our Democratic Party headquarters news, and I'm going to cover one here. And every day, if I can, I post links. This is a playlist on YouTube. See, that's the playlist, and it's all videos that I think are progressive issues or things that progressives should be aware of. You know, whether it's wars we're in and stuff like that. So this one was for the 13th of September 2018. And for some reason people only tend to look at the very first, even if they don't even look at that often. They will just, like here, James Holloman gets off into, you know, monetary theory. So we'll do that. We'll get off into monetary theory, and I'll let you see what we talked about.
How we pay for Medicare for all. An in-depth breakdown. W/Andrea Witt. James Holloman. Taxes do not fund spending.
Okay, so first I posted this, and that's what I showed you over here, and here you can hear a little bit of this.
Hi, Mike. I'm a big fan of your show. Happy to be on.
I'm a fan of you as well. For those of you who don't know, Andrea is an individual who is really rare. She likes math. And what's great about Andrea is she can kind of break things down in a way that is really easily digestible. So when she explains math to me, it actually makes sense. So tell us about what you do, because you're a graphic designer, you're the founder of Connect the Dots USA, and tell us what your YouTube channel focuses on.
Great. So like you said, I'm a professional graphic designer for the last 25 years. I've had my own business, and I got involved in politics and activism during the healthcare fight of 2009 because I buy my own health insurance since I started my business. So I'm very familiar with the individual market, and so that's why I got involved. And then I decided we have an education problem, and so I decided just to put my graphic design skills and my love of math to use, and so I created what I call they're easy to understand, easy to share, informative eye candy on today's most complex issues. So that'd be healthcare, the federal budget, and jobs in the economy are my top three.
And they are very, very thorough, but they're also very easy to understand for the average person. And you are really great because even certain politicians, I don't know if we can name names, are allowing you to give presentations for them, explaining how we pay for things.
Yeah, so I live in Tucson, Arizona, and Raul Grijalva is one of our representatives down here. He's in the neighboring district, but I always think of him as my representative because he's just a champion progressive. And he always calls me the professor when he sees me. So he's invited me sometimes to come during one of his town halls and do a presentation about healthcare, or recently about the Trump tax scam, and just kind of break it down for people in a visual way.
Right, and as she tells us how we pay for certain things, you're going to see why she's so useful and so helpful. So, Andrea, when it comes to the question, how do we pay for Medicare for all, that progressives are always asked, how do you answer that question?
Okay, well, we can start by talking about the fact that about 2/3 of all of the spending that we do on healthcare right now is already tax financed. So you sometimes hear that big number. We spend just over $3 trillion a year on healthcare in this country. That's about 18% of our economy. And that's, you know, the next nearest country is about 12%. So we spend an enormous amount on healthcare. So the money's already sloshing around in our healthcare system. It's just being spent very inefficiently because of all the different payers and the different programs and the cost sharing, and you've got private and you've got public. But when you realize that 2/3 of all of our spending is already tax financed. It doesn't sound like that big of a leap anymore. And plus, a Medicare for All system will save an enormous amount of money because you're just going to have one payer. So right away, you're going to save money overall, and that will use some of that savings to make Medicare, existing Medicare, more comprehensive, and then also will end up net saving money. So
Right.
that's the beginning of it. We're going to get into a lot more details.
Can you kind of go over some of like the key points? Like a lot of people like to cite the new number from the Mercatus study that there is 2.1 trillion in savings. So what do you think, if you can do some bullet points for us, what are the key benefits of switching to Medicare for All in your mind?
Okay, so the main thing is the moral argument that everyone is now covered. So, and it's not about having just access to insurance, you actually have health care. So the federal government becomes the single payer that pays all the bills, and that's the only difference. The doctors and hospitals and providers are all still the same. They're mainly in the private market like they are now. It's just we get rid of all the complexity, what I like to call a crazy quilt, because we have such a big hodgepodge.
You need new glasses, so why not have them delivered to your doorstep? At GlassesUSA.com, you can choose from thousands of styles, including brands like Ray-Ban, Oakley, DKNY, and more. See how the frames look on your face. And get your new pair online, starting at $48, including prescription lenses. Plus, get free shipping and returns. At GlassesUSA.com, you'll always find the perfect pair at affordable prices. Go to GlassesUSA.com today and get 50% off your first pair.
Of different systems. So that's like the big thing. So the big thing is we get everybody covered, which with much more comprehensive coverage, and you have much greater choice of doctors and hospitals than most people do now with their insurance, and we net save money.
Okay, this is 55 minutes, 40 seconds long, so I'm not going to play the whole thing, and she's kind of got the whole thing right there. Not all of it. And she is incredibly, she does a really good job of explaining it, and it's obvious that she knows her shit and that her numbers are correct. And that she's letting them supply the numbers, which kind of really screws them, right? Because if you use somebody else's numbers and then fill in the blanks, because obviously they're going to lie by omission, then you're going to have a great presentation that's reality based. So James wants to get into this MMT stuff, which is wonderful. I got my business degree, bachelor's, from one of the top 10 business schools in the United States, and that doesn't help me at all here, because I learned about MMT outside of school. Matter of fact, there isn't much that they taught me in school that's ever been of any use to me, outside of when I was in first and second grade and they taught me basic math. It's about all that I've used. And accounting is just an extension, a real world extension of that. And yeah, I got honors in accounting. But after being sent to Oxford and then being told to go to, well, not told, but offered to go to Harvard, which is almost like being told. I mean, I ended up avoiding all that, and I still ended up in, according to Newsweek, and I forget what the other magazine was, World News, something or other, another Time or Newsweek, another CIA rag. According to them, I was in one of the top 10 schools. And I still say to this day, it's all my dad's connections that made that possible. I'm sure that the people who offered to send me to Harvard and sent me to Oxford, I'm sure that they arranged for their CIA rags to make the school that I went to one of the top 10 business schools, the Cameron School of Business at University of St. Thomas in Houston. I'm sure it's well documented. So, you know, I get MMT. I studied MMT on my own, and I don't have any problem with it. And I'm sure that a lot of my monetary theory is based on MMT, because it's been influential on me as well. However, while my economic theory you don't have to explain to anybody, because there's the reason it's called pie in the sky is because it's not based on any kind of like gold or silver or whatever. Well, I'll explain mine, but what I'm trying to tell James here is that you don't want to get off into that when you're arguing Medicare for all. I mean, this woman is sticking within the framework of what we have right now, and you have to do that. You can't just pretend like we're going to completely change the monetary system overnight. And what do you want? You want us to wait until you prove that MMT works to get Medicare for all? No, you get Medicare for all right now. Next president, 2020, whether it's Bernie Sanders or it's whoever, better be a progressive or you won't get it. You better be a progressive like Bernie Sanders. Now, I'm against Bernie Sanders' support for Hillary Clinton. Shillery Clinton, the shill. And, you know, I understand he didn't want to see America suffer. So he knew that Donald Trump and all the people like him, all the conservatives and racists and everything, he knew how bad that was going to be. I knew how bad it was for the country, but I would have voted for him if it would have meant keeping Hillary Clinton out of the leadership of the Democratic Party via the President of the United States, because that's what she wanted. Now she's not the leader of the President of the party. We're still, these establishment Democrats are still hearkening back to Obama. Oh, he's like still kind of the quasi-leader, while we've got Nancy Pelosi and all these douchebags who are actually running it. And I don't understand Nancy Pelosi. You know, she comes from a family of progressives. What happened to her? I guess politics happened to her. I don't know. So anyway, James Holloman, you don't mix up MMT into the Medicare for all. I mean, you can for me, but doing it to other people, you're just going to confuse them. And you're going to confuse the issue. Medicare for all and all other types of humanitarian efforts that we're making as progressives, they stand on their own. It doesn't matter what economic theory, system, what kind of monetary system theory. We know that we need to take care of our people and end poverty. We know that. And I know that you can do it under any system. All you need is the will to do it. Now, are you right? Yeah, of course you're right. MMT, and especially my theory, I think my theory is better because it does base something. My theory bases the money in circulation upon the total assets, both real and imagined, as in future assets. So you put out, well, I'll explain it here because I'm going to play this whole thing. I'm going to put it on into voice synthesis and play it for you. So I'll show you a little bit of what James is talking about so you understand. I mean, first of all, go to Wikipedia and look up modern monetary theory. And by the way, one of the things that really bugs me about people who talk about MMT is they never tell you what it is. I mean, I had to go look it up, even though I know what it is, because I couldn't remember. I haven't even thought about it, because I work on my own theories, my own monetary theories, and that's all I've worked on. I haven't looked into older stuff for a long time. So you can go here and you can read all the stuff about, and I'm not going to do it. It bores the shit out of me. I mean, it's not anything that I don't know already. I mean, for Christ's sakes, they're talking about kinds, Keynesian, and all this kind of stuff. Marx. Here, I'll let you listen to some of what James posted.
And I said, well, there are no flaws depending upon your definition. Depending upon your definition of flaws and what you think MMT is and what it is not. So tonight I didn't have enough time.
Okay, so he's saying there's no flaws whatsoever. I would agree with him for the most part, but he's not looking into the hearts and minds of the American people. First of all, the American people are incredibly propagandized and therefore biased against anything that would even suggest that we can make all our dreams come true. We can end poverty and we can end homelessness and all this stuff, right? So you have to take that into account. And the first thing those people are going to say is that money has to be backed by something. And the idea behind that is that if you're going to be trading it, and trading it overseas and here and there and everywhere, at some point, the people who have that money need to be able to, if they wish, or maybe they don't need to be. Maybe you could not let them just have anything that they want for that in exchange for that money. But people are not going to hold on to paper if it's not backed by anything. Of course, it's backed by whatever you can buy with it, right? So whatever you can call somebody up and on order and or make a deal with somebody. So in that sense, all money is backed. But I'm adding in, and I've had this theory for a long time now, that it should be based on all assets, real and imagined. And I'll explain that. But that's the flaw that they're going to most often point to. And he's right. It's not a real flaw. It's a perceived flaw put in the minds of people who, by people who don't want MMT to exist. Don't want it to be experimented with. I mean, we don't have to do it all at once. We could just try funding some things based on MMT. You know, but you do have to worry about inflation. So the way to cap inflation is to make MMT, to make all the money backed by the entire assets, real and future, as in you got something that you're creating with the money. And you'll see, I'll talk about that in the voice synthesis thing. But here you can listen to him again.
It was a crazy week. You know, I'd be there, typing forever, to say what I wanted to say. Thought about doing a short 15-minute video, but then, the wife, the kids, and, work, and all the other things that I got going on in my life, and never got around to it. So I thought, okay, fine. I'll do this show instead of doing what I was going to do. I would do this. What is MMT? What is it not? So obviously I think MMT has no flaws. Because MMT just is. MMT is a description of currency. And I know there's a lot of people out there that explain MMT, and some people do it incredibly well, and some people don't do it completely. I don't know of anyone that doesn't do it well, but there are some people that do it a little bit piecemeal, and they don't put in what I would consider to be some salient details because of all the complaints that we have about what MMT is. You just want to print money. No, we don't want to just print money. So I want to discuss MMT. What is it? What it is not. First and foremost, MMT is a description of currency. Beyond that, that's really all it is. Now, just once you describe the currency, that leads to a lot of unassailable truths. But MMT is simply a description of currency. It tells us where dollars are born, how it circulates through the economy, and where those dollars go to die, where they meet their final end. And that's it. And from those, as I said, we can, piecemeal a bunch of macroeconomic truths. And that's about as far as it goes, as far as what MMT is. Those that espouse MMT, those that talk about MMT, we definitely have economic prescriptions for what's going on in this country. We know how we would like to apply MMT. But bear in mind, MMT, simply being a description of currency, describes the economic system we have right now. It describes the gold standard, it describes the Eurozone, and it describes the dollars that you have in your pocket right now. So what is MMT? MMT basically says that a sovereign government with a sovereign fiat, non-convertible, free-floating currency can never go broke. It can never become insolvent, and it can never be unable to pay its bills if those bills come due in its own currency. So I want to unpack this a little bit. Back in 47? I think it was 47. A man by the name of Rummel was the head of the New York Federal Exchange, Federal Reserve. And he wrote an article says that federal taxes for spending are obsolete. And I'm going to describe why he meant that by first describing the gold standard and why we think even in today we need taxes and borrowing to be able to afford things. If you are on a gold standard, if you say that for every dollar you hold, it is actually worth a certain amount of gold, the federal government promises to exchange your dollars for a certain amount of gold. So if I've got $20 and I would rather have gold instead of a paper bill, I go to the Federal Reserve and I exchange it. I think I'm overmodulating my voice. And I go and I exchange it, and they will give me a certain amount of gold. 30 ounces of gold to $1, well, times that by 20, and that's how much gold I get to take away. So if that's what they're doing, then please understand that they have to make sure that for every dollar they have in circulation, there is a certain amount of gold available. So if everyone all at once wants to be able to exchange their dollars for gold, we got it here. If they spend more money, if they create more dollars than they have in gold reserves, then they have technically devalued the dollar. So they got to be careful. So if we have a situation, for example, we have 200 billion pounds of gold, and the federal government has decided that, and I'll keep the math real simple here. Ellis Willingham does this all the time. I think it's brilliant. Just to keep the math simple. I've got 200 billion pounds of gold, and the U.S. government has decided that $1 is worth 1 pound of gold. Now, please understand, that is the most expensive dollar bill there has ever been. But for the sake of argument, $1, 1 pound of gold. Ergo, 200 billion pounds of gold, I can only have $200 billion in circulation. Anything more than that, I start to devalue the dollar. So if I want to spend more than $200 billion, if I need to fund federal programs, whether it be a war, whether it be a social program, whatever it be, and I need to have more than $200 billion in circulation, but I've only got 200 billion pounds of gold, I need to be able to find other revenue. One of the first things you can do is taxes. I'm going to tax you anyway, and we'll talk about why we tax in a minute. But I'm going to tax you. That was always going to happen. $200 billion in circulation. Let's say I need to spend $220 billion to fund the programs that I need to this year. So I'm going to take $20 billion of your tax money, and I'm going to recirculate that into the population. I will re-spend it. Ergo, I have now spent $220 billion, but it's still only $200 billion in circulation. See how that works? I have now spent more in a given year, but some of that was already created. I just recycled it in. I still only have $200 billion. The gold reserves are now secure. If I need to spend more than that, and I can only tax you so much, if I tax you completely, then no one has any money. I'm not going to do that. But, as we know, some people collect money, they hoard money, other people don't have very much. But if I need to spend more, let's say I needed to spend $250 billion, well, I'll tax $20 billion and re-spend it, but I still need to come up with $30 billion more. Well, here's some rich people that aren't doing anything with the money they have. They're just sitting on it. And I say, have a treasury. I will sell you a bond, and I will promise to repay this with interest. They say, thank you very much. It's free money. So I get their $30 billion. I spend it into the economy with an eye to increasing my tax base so that I can repay this bond with the interest.
Okay. So you get the idea, right? And by the way, this can also get very, very complicated. The capitalist system is unnecessarily complicated on purpose. Number one, so that anybody questions it, they have a very hard time explaining what they're talking about to anybody, including him. You know, there are simple things like, guy got his leg cut off. He could have it reattached and possibly working again, which would mean that he would be one of my assets again, whereas if he was without a leg, he'd be more of a, what do you call, a liability, right? I mean, we'd have to pay for him to get a prosthetic, and it is complicated, but my theory is doable. Their theory is doable, but it scares everybody because they're propagandized. You know, my theory takes care of that, and none of this should really be part of the healthcare argument, except for among more informed people who understand what it's all about. You know, you throw something like MMT into the debate with all these, no offense, well, yeah, there's no way you're not going to take offense, but all the idiots out there, people who, yeah, I think, you know, you're just going to end up with everybody walking away and nothing being done. So I certainly don't agree with handling things that way. And I don't agree with bringing things like MMT into it, especially since it's not going to be part of healthcare. Later, it may have an umbrella effect over healthcare, because one way or another, we're going to keep track of everything like we always do, which is good, right? I mean, it's good that we keep track of stuff. Even money is good. It's the people who take the system that money is so much a part of and turn it into something bad. So let's go on to see what I had to say, what James had to say, and I had to say.
Learn how our free-floating currency system works. If you do not, we progressives will always lose the how are you going to pay for it argument, and we'll never get the things we need for the common good our Constitution says is our government's charter. Martin.
Now, as far as paying for health care, to me, money doesn't have anything to do with it. When you look at paying for those kinds of things, you just make it happen. I mean, people have made it happen. I mean, you constantly hear that we're the last industrialized country in the world that doesn't have health care for all, because they made it happen. They have a monetary system, an economic system. They still managed to make it happen, and for years, 20 years, 30 years, until the conservative assholes who didn't like anybody who's not white getting the same kind of things as what white people were in England. For 30 years, the National Health Service, the NHS, worked really well. Now, it wasn't entirely fair. If you were in Oxford, like I was, when you went to the doctor, there was no line. Matter of fact, there wasn't anybody in the waiting room the whole time I was there, and after I left, until I left. There wasn't anybody in the waiting room. And as I came out, I went to pay, and she said, no, nobody pays here in England. And I was like, really? I mean, I was just a kid. I was only 16. I turned 17 there. And I said, well, what about... And I had a big wad of cash in my pocket, about 350 pounds. And I said, what about the fact that I'm an American? I'm not even a British citizen. She said, no, sorry, but we can't take your money. That's just not how it's done here. My jaw was on the floor. I mean, really. And I've told that story. That was 1976, I've told that story a million times, and sooner or later, people like Michael Moore and all the rest of the countries, they stories get passed around. So sooner or later, people figured it out. And yes, healthcare in Britain doesn't work as well now as it did back then, and that's because as more and more minorities want to take advantage of that system, and I don't mean take advantage in a bad way, I mean use it, the conservative white people really just don't want them to have it. It's not really hurting the white people in any way. They just don't like the idea of other people getting rich. They see over and over and over again everywhere across the world that when underprivileged poor people get an education and get a decent way of life, that they rise up and take everything away from the rich people. So they want to make sure that doesn't happen. So what they do is a balancing act. They make sure that most of the people are happy, and then they make sure that the rest of the people don't have any of the resources they need to rise up or to influence the other people who have stuff, but they could go either way, right? That's why we have so many racists in America, and in Britain, and in Germany, and in Hungary, and everywhere. I was just watching about Hungary today. They got massive right-wing thing going. Germany, riots where they're beating up people, and sometimes they have a right to be angry too, like two Syrian migrants, or probably Syrian, stabbed to death a police officer, in a brutal attack. So you get all this stuff going on. None of it's necessary. Create universal health care for all those people. They won't be out stabbing people in the street if they have a place to live, and if everybody's participating in the work that needs to be done, at least until retirement or before, not children, obviously. So, here's some of what I had to say, and we'll see what...
Drummond, I didn't think she lost anything. I thought her analysis was right on the money. On the money, get it, lol, ha 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 ha. Not only that, but rather than getting into all kinds of pie-in-the-sky monetary theories, she stuck to the facts as they exist in the capitalist system, something that average people can wrap their minds around. So I will be using this interview with her over your link to explain to people what is going on with healthcare in this country for a long time. Sorry if that disappoints you, James Hollowman. There is nothing mysterious about MMT. What's hard to wrap your noodle around is how the gold standard is even going to work. When we had it, it didn't. There was a depression about once every decade. MMT is how your money works, whether it's under capitalism or any other ism. I don't know who you think won the battle for universal healthcare insurance, but they forget to collect their prize. Better let them know. Martin Drummond, I have a solution for that. You base a country's current key on its total assets, both real and, well, I forget what the other one is called, but on the total assets of the country. So basically you say you have all the money in circulation or in loan for what have you, representing what you claim to be the worth of your country. Martin Drummond, obviously you would have to define assets, which is complex, but it's already being done regularly. But even the person's ability to work in the future is an asset. And many other seemingly strange things are considered assets. So everyone participating in such a system would obviously have to be regulated. As it is now, except it would not be able to create more money than it is capable of producing under the definition of provable assets as defined by somebody that is beyond reproach. Obviously, Martin Drummond, anyone is welcome to spread and use this idea. I came up with it a while ago, and I am sure I am not the first. But it makes more sense than any of the monetary theories you've seen, Martin Drummond. So obviously MMT is a subset of my monetary theory. People are going to want their money based on something that exists. The asset that MMT would represent is future assets. So you would issue the money to pay for the asset, like health care, and after it was produced it would be the asset that would back the currency. So whether you're getting gold out of the ground or building a hospital, it wouldn't matter. You would take the appraised value of the asset and back it with the money printed to create and maintain it, and when the asset was gone, so would the money. On the flip side of that, the asset would back the money in circulation, and the money in circulation would represent the assets of the country. Pretty simple, really. MMT is nothing new BTW, but most people have never even heard of it.
Okay, so if you have any questions, you can post it either as a comment under my YouTube video that this is going to be, or you can come here to Democratic Party headquarters and try and find don't look in the like pinned posts, what are they called now? Announcements now. Don't look in there. It'll be on the timeline, and they're all, you might want to click on when they show them. They give them either in most recent or something else. But if you click on most recent, then they'll be in order and you can go down through them and find the one for the date you're looking for, which is 1809-13, which is 2018, September 13th. September 13th. Oh. And 2 days after 9/11. I guess it's always 2 days after 9/11, right? All right. I'd say that covers it.